Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back to the podcast series on insulin resistance. I'm your host, Dr. Candace Pierce, and joining me to continue this discussion is Jane Olkey. Jane, thank you for taking time to continue this discussion with me.
I'm glad to be here.
Yes. Listeners, if you have not checked out episode 1, Understanding Insulin Resistance, I really encourage you to do so. Jane shared some really great information to really get down to the basics of what is insulin resistance. So now before we really jump into managing and treating insulin resistance, I wanted to kind of share some eye-opening statistics just around insulin resistance and prediabetes. So Jane, feel free to interject anything around these statistics. And I do tend to talk fast, so just jump in if there's something that you want to share. I saw where the American Heart Association actually identified insulin resistance as a significant risk factor for, I guess you could call them precursors to cardiovascular diseases. So more likely to have hypertension, dyslipidemia, which we know leads to disease and stroke. The CDC has estimated 88 million American adults, so that would be about 1 in 3 have prediabetes, often associated with insulin resistance. And the CDC has also identified that insulin resistance and its related conditions like type 2 diabetes disproportionately affect certain ethnic groups. Most significantly, they've identified Hispanic and the African American populations have higher rates of insulin resistance and diabetes compared to non-Hispanic white population. So these are some really eye-opening significant statistics for something that I don't think is talked about enough, or maybe even treated enough. What are your thoughts, Jane?
That's true. A lot of what you just said is, really true. That certain ethnic groups have an issue, and more so than others, on how, and it could be underlying their, how they're eating, and they're just grown up that way, so they have to watch it more. History of gestational diabetes, different how you live your life, different things. Heart disease is a major factor in insulin resistance. It's one of the underlying causes of metabolic syndrome. So we're trying to get that all into balance and check, and it shows up in many different ways in our bodies, both with symptoms and with blood markers and things like that. So, yep.
All right. So looking at lifestyle modifications, what are the most effective lifestyle modifications that are actually effective in managing resistance?
We talked earlier, about how limiting processed foods. We'd say about 67% of our diet is ultra processed foods. What's ultra processed? Anything that comes in a box or a bag that has many different ingredients in there. Some of them we can't pronounce. Again, that breaks down not just to sugar. There's a lot of sugar in those foods. But I actually recommend my clients not to try to buy anything with no added sugars. It's like, oh my gosh, how hard it is?
It is very hard.
I teach some of my classes, I said, your homework is to go out and find a snack that doesn't have any added sugars. And there are some out there. You can come back with them and stuff. So I have my favorites and things. So there are some out there. But you want to look at something that doesn't have a lot of added sugar. Whenever you add sugar to something, it causes some level of insulin resistance. So, and processed starches too. Some different starches turn to sugar. And I've heard about the glycemic index. You've heard about that and the glycemic load. I use a lot of glycemic load numbers with my clients to find out, what are they eating? Are they getting too many foods that turn to sugar in their system? So are they eating a lot of starches have higher glycemic load numbers. And so I recommend when you look at the glycemic load points is to keep it between 50 and 80 a day to keep your blood sugar in balance. So looking at what you're eating, is it mostly carbs and starches that break down into sugar very quickly? So I don't believe every carb is the same. Different vegetables don't turn to sugar as quickly. And certain starches turn to sugar way too quickly. So depending how much fiber is in it, also if you're going to go eat bread, make sure it's got a lot of fiber in it. At least 3 grams per slice. So again, look at, oh my gosh, again, that's hard to find. Actually, or ideally organic too, but that's another story. But, again, looking at, it's just keeping it as clean as
Right.
possible. So basically looking at what you're eating every day. Are you eating a lot of high starchy foods? Sometimes with my coaching clients, I have them write down what they're eating and have it analyzed on an app on my phone or on their phone to find out how many, a percentage of carbs, fats, and proteins. I like to keep it pretty even. 33% of carbs, 33% of protein, 33% of fat. Keeps it pretty even. And you can do this easily and find out if that's what you're doing, because a lot of people find out they're eating like 80% carbs, and wondering why they can't lose weight, that kind of a thing. So
Right.
it's something to pay attention to. But again, get as much whole food as possible in your diet, real food, not processed food, not ultra processed food, and just trying to clean up the diet and keep it as simple as possible is the number one thing. But another thing was a 12-hour fast. I mentioned it earlier, but I think that's really important, not to eat continuously during the day. Trying to do breakfast, lunch, and dinner. So if you eat breakfast at 7, lunch at noon, and dinner at 5 or 6, you can stop eating, by 7. And then don't eat again until 7 o'clock in the morning. Again, that's an anti-aging factor. They call restricted time eating, has been shown to keep longevity going and stuff like that. So if you're eating all the time, in fact, to sleep better, ideally you don't want to eat 3 hours before you go to bed, because if you go to bed, your brain's cleansing itself at night. So you want to make sure that you're giving your time for your brain to clean itself. If it doesn't have time to do that, it's not going to. You're going to have a lot of brain fog the next day. So if you're eating before you go to bed and your body's spending time digesting food, you're not going to actually get your brain to cleanse at night. So again, stopping eating 3 hours before bed is like the first thing I tell people to do, and then go to the 12-hour fasting. So create something called autophagy. Autophagy is breaking down of old metabolic waste, which we need to do. I mean, that metabolic waste is one of the underlying causes of cancer, these cells that are unregulated and stuff like that. So again, you want your body to be able to cleanse itself. And when you're not eating, that's the only time that you have time to do that. So that's important, I think. So
when you're talking about fasting, I know you've mentioned 12 hours, but I've also seen people who are like 18 hours of fasting. Is there like a set amount of hours? Is more better, or...
you could do the 18-hour fasting. The trouble is, I want to make sure that you're eating at least twice a day. When somebody, I just eat once a day, that's kind of hard on the blood sugar. Again, it's too much work for for the energy for the body. So I like to have at least 2 meals a day if you're going to do meals, whether, let's say at noon and 6 o'clock at night or something like that would be like, 6 hours, right? Something like that. But you want to make sure that you're eating at least twice a day. So for the blood sugar in control, and see when you're hungry. I tend to be hungry in the breakfast. I want to eat breakfast. I can stop eating early in the evening, but so some people want to eat later in the evening, so they don't have breakfast till like 10 o'clock. So again, find out when you are hungry and kind of go with your metabolism, because someone says, oh, I can live without breakfast, and some people can't. So you want to find out what works for you on fasting, and go with what your body's telling you.
Right. What about physical activity? Because, I've heard different things like don't do high intensity workouts if you have insulin resistance. Focus on things that lower your cortisol levels, like yoga or, walking. So what are those good modifications for physical activity?
Well, we need to build up our muscle. So basically, and one of the things is our glucose goes into our muscles to create energy. So if our muscles are weak, and one of the things of insulin resistance, if we can't get the energy into the muscles, we get more muscle weakness. So one of the anti-aging factors also is building your muscles up. So muscles use more sugar than for energy. So exercise is super important. So we need to do that. It keeps blood sugar in control. So the more you're exercising, the more you can use up the excess sugar. So if you are eating some carbs, that's why some people do some carbs before they exercise, because they're going to use those carbs to in the muscles right away to use them. So that makes some sense. But what you said, walking is actually a great exercise, because it doesn't strain your muscles, your knees, and it's not excessive. And we all need to walk. I recommend measuring steps a day to see how many steps you're getting. If you're not getting them regularly, if you're sitting down too long, a lot of the different devices will measure, how long you're sitting, and we're not supposed to be sitting anymore, we're more than an
Right.
hour at a time, which is difficult if you're working, so
Yes.
basically, but yeah, I know. So basically, and the more, the imbalance of, exercise, losing weight is helpful too. But again, you want to reduce the like all the visceral fat in your system, and exercise helps that, because you want to get that visceral fat, the belly fat. Basically, it's an active form of causing inflammation in your body if you have that. So again, exercises that help remove that belly fat is super important too. And like you said, like high intensity exercises, sometimes that raises cortisol, or can stress you out too much. You have to find out where your ability is on exercising, how much you can handle, and not doing too much, or things that can cause either stress or injury if you're doing too much, and things like that.
Right. Absolutely. Are there any other types of lifestyle modifications that we should look at alongside what we eat and our physical activity?
Well, a couple of things. To reduce cortisol levels, you want to make sure you're sleeping well. That's another thing. I know a lot of people have issues with that. Basically, like sleep apnea, we talked about like that. Finding out, what, again, we talked about also not eating before you go to sleep. Sleeping is important. Reducing stress, meditation is helpful for reducing stress. Yoga, things that just kind of calm your body down. Just, again, when you're having trouble sleeping, what do you do? Actually, I tell one of my things I teach in my classes to reduce stress is something from Brain Gym. I've never heard of Brain Gym, but what you do when you're stressed out is just put your hand over your forehead, and you'll see people doing this when they're stressed out. You'll just say, "Oh my gosh, I'm so stressed out," and that's an instinctive action. Basically, there's two like called neurovascular holding points right here. If you look up in Brain Gym, it's called positive points or emotional stress release points. So when you put your hand over your forehead and breathe, it can actually calm down your stress level in your whole body. So when someone comes into my office and they start have an anxiety attack, or they're stressed out about something, or have had something happen on the way here, traffic or something, I said, just either put your hand over your forehead, or I put my hand on their forehead very lightly. I'm not pressing at all. Sometimes I'll put my hand over the back of my head and have them talk, and I'll say, okay, just talk. And then all of a sudden they'll just do a big relaxes the whole layer of stress has gone out. And so you can do this for yourself, and just kind of reduce your stress level and help kind of calm yourself down. There's a lot of different techniques that you can use, and I use that one a lot.
I did feel it. I mean, when I did this, like just the breathing with it, I felt a difference.
Yeah, it makes a difference. Actually, I used to teach anatomy physiology class at the college, and I used to tell my students, I said, if you study your work and stuff like this, and then you get to the test, and you have this, forget everything. It says, put your hand over your forehead, because that's your frontal lobe of your brain. That's your filing cabinet of all your memories and stuff like that. It'll come to you, and it works. They come back and they say, oh, it helps me. It helps with your memory too. So if you're having trouble remembering something, your shopping list, you're just kind of
test-taking technique right here.
Right. Test-taking technique. Yeah, exactly. It does work. It's just, but we're learning different things that can reduce stress. The other thing I do is heart-centered breathing. Have you heard about that? Just instead of stressing out about your mind, just breathe through your heart. It's something through heart math. And heart math is where they just, instead of being stressed out, you just put your hands over your heart, one hand or both hands, and just breathe in 5 breaths, and then breathe out 5 breaths, slowing your heart rate down. That slows your blood pressure down, gets your body into coherence. If you think about something you appreciate, or something you're thankful for, gratitude, it really brings down your body and gets you about something called coherence, and your body can regulate itself more. So whenever you're stressed out, you can do this too, and that's another way. If I'm having trouble sleeping, I'll just do that, and then poof, I'm asleep.
I like this better than the box breathing, the strategy both of these seem more helpful than the box breathing to me personally.
Okay. Right. Yeah, whatever works for you. I mean, you find out what works for, and those are my two favorite things to do with clients, and teaching them, like, just, this, how do you reduce stress? Because we all have stress.
Right.
The cortisol's there. How do you reduce it? And, that's what keeps us awake, at night, and things, thinking about, what your stresses as things are happening, and, whether you're going to, have a talk to give, or a trip to go on or something. It's good. It could be good stresses, but they can still cause stress and lack of sleep and cortisol to go up, so.
Yes.
Yeah.
My daughter is recovering from CRPS, complex regional pain syndrome. She's in remission now, with her pain is gone. But one of the things that she came home with was a tool. I'm trying to remember what it's called, but it basically does vagal nerve stimulation. And so it touches these areas, and then it vibrates those areas for like, I think 3 minutes, to help with calming down the nervous system response.
That sounds interesting. I haven't heard about that. Okay.
Yeah. So, but I feel like it goes right along with, where you're talking about calming yourself down and being able to knock yourself out of fight or flight.
Exactly.
It seems like the fight or flight is really what messes us up with our cortisol levels.
True. Yes. Our body's on that danger response. I call it cell danger response when we can't create the energy we want. That's another thing people are getting into is just, your body in a cell danger response, or you're always, fearful of something going on. It can't create energy. It can't do two things at once. And that can cause, mitochondrial weakness. And that's another whole topic. But yeah, so.
We have so many rabbit hole topics we could go down with this. It's so good. I love this. Thank you so much for sharing all of this. So we have diet, we have exercise, we have go to sleep, we have stress techniques. Is there anything else as far as lifestyle modifications that are helpful?
Well, I'm trying to think of some, there are some supplements available. Again, supplements are again, you have to make sure that you're taking the right ones and stuff like that. So don't just take anything over the counter, stress reduction things. I mean, there's, like people take lemon balm for calming. There's different herbs out there that help. So sometimes that helps, there's ashwagandha, which is an herb that helps a lot with cortisol specifically, actually, I'll admit, I went to see a doctor last year for stress, and he recommended something called Calm Your Brain. It's like, oh, shoot, okay. So it's got ashwagandha in it, because he says you're a pretty driven person and you do a lot. And so he says, okay, you need something to calm your brain. So it's called Calm My Brain. And so I take that, to calm my brain. And it does help, reduces it. So there are things out there, but you have to find what works for you, because different things work for different people. And depending on again, I look at blood work to find out, what do you need? Do you need more B vitamins? B vitamins are very important also for reducing stress, especially, they're found in dark green leafy vegetables. So when you're eating dark green leafy vegetables, you can get the benefits of B vitamins. But a lot of times we need like B1 for stamina if you're always tired, B3s for niacins for circulation, help improving circulation. B6 is for nervous system energy if you've got tingling going on in your body. B9 and is folate, for methylation, and then B12 for improving memory and things like that. So we need them all. So just taking one's not working, but I like taking a complex of B vitamins. A lot of times people notice a huge reduction in cortisol levels and stress when they get a right amount of B vitamins in their diet or in their supplementation. So that's another area to look at and see what's going on with that.
I need to write that down, B vitamins. So, talking about supplements, what about any pharmacological treatments that may be available for insulin resistance along with the supplements?
Right, they're not official any medications for it. Again, we look at metformins for diabetes and things like that. There's some side effects with taking that. You don't want to be taking that unless you absolutely need to. That's a common, medication for diabetics, but some people have reactions with that. There's a lot of different things can happen with that. So basically, there's another line where you've watched commercials nowadays. I'm not going to mention any names, but the GLP-1 injections that you see on TV.
Right.
But again, those are used now. They were used mostly a few years ago just for diabetics to balance that glucagon peptide, GLP, and it balances that. So basically, it can cause a lot of problems, but it does. In a way, kind of work for insulin resistance. I'm not recommending it. Most of the clients that I have that have tried it have gotten off of it. But again, it can cause, it actually triggers insulin release I'm looking at some notes I have about it, but because it's relatively new to me, triggers release from the pancreas and it blocks glucagon secretion. So and so increases blood sugar when necessary. So and then slows stomach emptying, and that's where a lot of the problems come in. If people get they get nauseated, they get all sorts of problems from that because it just stops everything from happening. So that's one of the major side effects from that. So I don't really recommend it for that reason. But again, looking at your hunger feelings, there's other things like you mentioned. Berberine is something that a lot of people use as another herb that helps. I've used that with a number of other things, trying to find out what other herb works with it. I haven't found the one that works with it, but berberine is one of the common supplements that actually does work similar to GLP-1, but not by itself. There's other things that can work with it. So, but yeah. So
going on berberine, I was going to ask too, like if somebody was looking at taking berberine for insulin resistance, is there a milligram that and what side effects, like diarrhea, vomiting?
No, it doesn't do that. It's, to me, actually, berberine, and whenever I've used berberine before, they use it to improve the effects of other things that it mixes it with. So I've seen it added to things to actually increase the actions of the other herbs. So now they're starting to use it by itself. I've used it,
along
with milk thistle, alpha lipoic acid, and acetylcysteine for energy. It kind of increases different things going on in the body. So it's to me, I'm not sure how many milligrams. I'd have to look at a label of something I don't have in front of me, but usually around 300 milligrams is what most herbs are pretty safe at. But you don't want to do too much. Too much of any herb is not recommended. Again, like I said, it's usually something that activates other things that you're doing. So again, to me, it's something that you want to add with other supplements that you're doing to see if it's going to help work it with you specifically.
Yes. I know one of the things I'd heard about with berberine, it's such a tongue twister, is it has antimicrobial effects. So discouraging for long-term use, or I'd talked to somebody who had done a month on, a month off due to the antimicrobial effects of it. I don't know if you're familiar with what they're talking about.
Not so much about that, no. Again, like I said, you often put in things that's in minimal amounts just to support things. So, antimicrobial. I mean, it's good to keep the microbes in check, but not constantly killing them off. I don't know that it actually kills it off. Kills off the microbes and stuff. So,
another one that I'd heard was omega-3s. High doses of omega-3s.
Yeah, omega-3 good fats. Basically, our cells are made of fat, so we need to make sure that we're not avoiding fat. We need some good fats in our diet. Basically, like I said, if you're trying to totally prevent fat, you can get like a hard and crusty cells, which you don't want. You'll get stiffness in the body. So they're anti-inflammatory omega-3s. So if someone has inflammation, that's the number one thing I look at for that. Inflammation, also for blood sugar balancing, it does help a lot. So I recommend quite a bit of omega-3s. I usually minimum of like 1,000 milligrams a day, and then up to 2,000 or 3,000 milligrams a day, depending on if you're having heart disease. Again, it can be almost like a blood thinner, so you have to be careful if you're on medications. Because it can, thin the blood, and so that some doctors don't want you to be on omega-3s if you're on other blood thinner medications and stuff. So again, but it's something that does help a lot with circulation. Again, if you're having brain fog, if you're having inflammation or pain or stiffness, omega-3s is really helpful for that.
Right. Are there any other supplements that you recommend alongside the omegas and the berberines?
Along with B vitamins, I often recommend magnesium. Magnesium is another mineral that's really helpful for reducing stress. It works on the muscles. So basically, magnesium actually helps enzymes react better in your body. Also helps B vitamins get absorbed better. So that's another supplement that I recommend a lot of people. There's different kinds of magnesium out there. Magnesium citrate is really good for oxygenation. Magnesium glycinate's good for metabolism. So if someone's diabetic or pre-diabetic, I usually recommend magnesium glycinate. It's more of a metabolism type magnesium out there. So you can get these different types, and some of them have combinations because like magnesium aspartate's good for the muscles. So if you have muscle pain, again, you may want a combination of different things and see what works for you. So someone says, oh, you got to be careful if you take certain kinds that it can cause diarrhea, and some people actually take it for that purpose, sometimes actually. But it does help at night to sleep. People take it at night. Some people take it with melatonin and B6 to help sleep, because magnesium and B6 actually reduce GABA, which is a neurotransmitter that can cause stress. It's a high inhibitory neurotransmitter, and basically when that's high, you sometimes have trouble sleeping also. So magnesium and B6 together helps with that. So a magnesium and B complex is helpful for that.
I take a magnesium to help me sleep, but it's not one of the two that you mentioned. I feel like it's magnesium threonate.
Threonate?
Threonate, yes.
Threonate, yeah, threonate. Yeah, that's worked on more. That's one more for the brain. It does help with the brain. It's a more expensive kind, but yeah, it's just it does. I mean, it helps with the brain magnesium for the brain specifically. So, but
right.
Yeah, citrate's helpful for, just like I said, oxygenation, getting more energy to the cells too. So that's some people, but use that one. That's one that can cause diarrhea. Magnesium oxide is a kind you usually find in regular stores. It's the cheapest kind. It can also cause diarrhea, so you have to be careful how much you're taking.
Oh, good to know. So really, it's more along the lines of supplements that help with dealing with insulin resistance versus pharmacological things we go get at the pharmacy.
Right. I mean, like I said, there really isn't a medication for insulin resistance at this time officially. But I think supplements, if we can supplement what our body's getting, the nutrition that we're not getting, it can actually help a lot with, maybe even stopping some of the food cravings that we have. So the reason we have these food cravings is we're not getting what we want. And the more sugar we have, the more B vitamins we need. So it's kind of interesting to understand that. Yeah.
That is. When I started this insulin resistance journey, one of the first things that I was offered was a GLP-1 for, the theory was if I lost the weight, then that would take care of the, insulin resistance. However, I have really high cortisol levels too. So I don't know how well that would have worked with really helping me with my insulin resistance. I just found it interesting that was the first thing I was offered was a GLP-1. I didn't take it, but...
Yeah, that is interesting. Yeah, they're trying to look the quick fix. The trouble is when you get off of that, the weight goes back up because it just suppresses what's going on. But again, to me, I'd be looking at like ashwagandha, magnesium, B vitamins, something that's going to give you the underlying nutritional energy that you need to balance even the cortisol levels, because B vitamins can help with that too. So.
Absolutely. So as healthcare professionals, how can we better support patients in making these sustainable lifestyle changes?
Basically, when I coach people, I find out, what are their challenges in creating a healthy diet. Why, like some people say, well, like you said, you're going to go traveling, So basically, if when you eat, travel, you want to go eat, have fun and eat, that kind of stuff. When you go out to food, you want to go to someone's house, eat what they're having. But again, try to find out where they are and what they're willing to do. How important it is for them? I call it their why. Why do they want to be healthy? Do they want to prevent long-term, diabetes? We want to prevent that. Why do we want to do that? And then support them in having measurable results. So if you have high triglycerides or high fasting blood sugar, one of the things I would like to get actually is one of those continuous blood glucose monitors, just to see where it's at. When does it go up and down? And we can't just get those anymore. I don't think, I haven't tried actually, but just to see, because I've had some problems with my blood sugar going down. I'd love to know where it's at, that kind of a thing, and what makes it go up. But I think if we figure that out, we can actually find out what's causing us to be out of balance. We can make better decisions. So when we have more measurable results and things that we are working on, we can see progress. And when you see progress, you can keep going in the right direction. So I think that's really important.
I'm seeing more and more studies come out about insulin resistance. And actually today, before we recorded this, I saw an article that was coming out about people who actually, we say that they're healthy because they are a healthy weight, but even they still had high insulin levels. They had insulin resistance, according to the ratio that you had mentioned before with your triglycerides. And is it HDLs?
HDL, yeah, triglycerides over HDL. Yep. If you look at that, that's one of the major markers of insulin resistance. And yeah, you can be thin, you don't have to be heavy, but usually a lot of even the thin people are starting to gain weight in their abdomen. So look at that. They suggest to see where they're gaining weight. And I've had someone here last week that she said, I'm fine except for my belly fat.
Right.
And I'm saying, okay.
We know what that is.
Yes, that's, we know what that is. Yeah, exactly.
Right. Are you seeing any advancements in the treatment of insulin resistance, or is it still really trial and error?
I have not really seen a whole lot of new things coming up. Basically, like I mentioned, the continuous glucose monitors, helping people understand where they're at, what causes blood sugar to go up, being aware of what's going on. I think that's where we need to work on moving towards, so that people can make better decisions on, what works for them, and, what reduces their stress, their cortisol levels, their, and their insulin resistance. So they can reduce stress. So finding ways of reducing stress, building up resilience in the body is really helpful.
Absolutely. Well, that wraps up our time for this episode in our series on insulin resistance. Through this series, Dr. Ohlke has helped really shed some light on the fundamentals of insulin resistance, its pathophysiology, and the effective management strategies to help pull this back under control. Understanding and really managing insulin resistance, we know it can significantly improve patient outcomes in a lot of ways. So I'm going to try to do a quick little recap of some of the things that I've learned today. We can prevent or delay the onset of type 2 diabetes, reducing the risk of complications that we know come from type 2 diabetes, such as cardiovascular disease, neuropathy, and nephropathy. Normalizing blood glucose levels and improving lipid profiles really enhances overall metabolic health and well-being. And managing insulin resistance can really reduce the need for medical interventions and hospitalizations. Early management can prevent complications, like she mentioned, with PCOS and certain cancers and cardiovascular diseases. And really, it's all about encouraging a healthy diet, physical activity, and stress management that is really what supports long-term health and well-being. Am I missing anything, Jane?
No, sounds really great. Yes.
Well, I learned all this from you today. So a huge thank you to you for such an insightful discussion today.
It's been a pleasure. Thank you.
Yes, ma'am. To our listeners, thank you for taking time to listen to our discussion and equip yourself with the knowledge needed to provide amazing care to your patients struggling with insulin resistance. I also encourage you to explore many of the courses that we have available on elitelearning.com to help you continue to grow in your careers and to earn CEs.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.